Hey, this is Dr. Maureen Mickey. I'm at work right now. I started at 8 a.m. I'm doing a 24-hour shift. As you can see, the helicopter is behind me. We had a patient that came in for shortness of breath, no fever, and he went downhill big time, and we are having to transfer him out. We have one patient in the hospital with COVID-19 and one in isolation that's waiting for the results. We are a small rural hospital. We have no ventilators, and we're seeing already the infiltration finally of the virus into the rural areas of Alabama. So we'll just see how it goes, and we'll keep our fingers crossed and keep doing the best we can for the community and the surrounding communities. The surrounding communities now are also seeing an increased number of COVID-19 cases, so we're probably going to be seeing many more in the next few weeks here.
That is Dr. Maureen Mickey, an emergency medicine doctor in Evergreen, Alabama. The coronavirus epidemic has, of course, been raging in New York and in New Jersey and in Chicago and other dense urban places, but it really is spreading in America's rural areas, too. It's in 3 out of 4 American hospitals now. It's in 2/3 of America's rural counties. About 140 miles northeast of Dr. Mickey's ER in Evergreen, we got something else today from Alabama, from East Alabama Medical Center. This shows the hospital staff at East Alabama Medical Center celebrating their first coronavirus patient who improved enough that he could be taken off a ventilator. He's a 48-year-old man. He'd been in the ICU for more than 2 weeks, but he's off the vent. And that is great news. It's amazing footage. But he is the first, and so far the only patient they have had at East Alabama Medical Center who has gone onto a ventilator and lived and been able to come off it. He's number 1. As the New York Times reported today, the rural epidemic in America is exploding. This week, the case rate in rural areas was more than double what it was 6 days earlier. Governors of rural states who think it's not coming there are wrong. There is a rural coronavirus epidemic just taking off. This is a 50-state problem. It means as this moves into in significant quantity to places that have rural hospitals that may not be well equipped, that may not with large numbers of patients, all coping with the exact same illness. I mean, there's a whole new circle of hell ahead for us in this country in terms of how we strain our healthcare resources. That is ahead in terms of rural America.